Hi, my name is Bobby Milstein. I'm Director of System Strategy for Rethink Health and the Rippel Foundation. And I'm just going to tell a quick story of some of the issues we see involved when people and organizations step up as system stewards for well-being and equity. Now, our well-being relies on a system designed long ago, and there's no doubt that it can be much more effective, much more equitable, and efficient. Seeing that system is one thing, but recognizing our roles as stewards within it is really another. We believe that any person or organization could be a steward as long as they take responsibility for working with others to expand the conditions that all people need to thrive. Stewards can be connected to an organization, or they can act on their own agency as a community resident. Stewards have many interesting properties, but in particular, they have a special orientation around purpose, power, and wealth. Purposes of stewards are always larger than themselves and their own organizations. They view power as something to be built and distributed with others, not consolidated. And wealth is something to be invested, not withheld, to create long-term value and to address or alleviate short-term urgent needs. Now, with all of us acting as stewards playing a role, it helps to have a unifying and measurable goal. And one of the most intriguing goals could be that all of us could thrive, right? All people thriving, no exceptions. One of the very best measures in all of social science is an overall measure of life satisfaction that helps to reveal who feels that they're thriving and who's struggling and suffering. Many people are thriving and many others are not. There's a lot of work to do if we want all people to thrive without exceptions. And of course, some subgroups show very, very different patterns on this measure. For those who've been through high school or higher, a much larger fraction are thriving and fewer are struggling and suffering. Not so for those who haven't made it through high school. Fewer are thriving and many, many more are struggling and suffering. So these are among the challenges that we have if we want this pie chart to show all people thriving, no exceptions. So we should take a hard look at what are the conditions that actually allow us to feel like we're thriving, and when is it we struggle and suffer. For 30 years, we've had near consensus in the US and across the world that public health is what we do to assure conditions in which all people can be healthy. So we've had this idea of focusing on conditions, but we've never really come to any agreement about what those conditions are. And as a result, there's a lot of disarray and disorientation. Those of us who want to be change agents in the systems that we're a part of end up creating a lot of confusion and maybe sometimes not even being able to get out of our own way in figuring out what is the work that we're trying to do. There's a lot of euphemisms around what are the conditions that people need to be healthy and to reach their full potential. We talk about these as some mix of treatment and prevention or sort of mix of downstream and midstream and upstream care. And we talk about social determinants of health. We talk about social determinants of equity and causes and fundamental causes and actual causes. We classify these, and some of them are about healthcare and behaviors and socioeconomics and environmental factors. But the truth is, all of those euphemisms are just too vague to do the hard, serious work daily, everywhere, to assure conditions in which we all need to reach our full potential. And so for the last several years at Rethink Health and many other colleagues have been articulating a list of vital conditions that we all need for well-being. We need them on day one. We need them every day throughout of our lives, and everyone depends on these. These are basic needs for health and safety, right? Clean air, clean water, sleep, nutritious food, freedom from addiction and trauma, and routine healthcare. This is a package of basic needs that none of us could ever do without. And if we want to reach our potential, this list expands into things like lifelong learning and meaningful work and wealth, humane housing, a thriving natural world, reliable transportation, and that sense of belonging that all human beings need to feel like they're part of a larger community, and a sense of civic muscle that we can contribute and help to shape a common world. Many institutions have begun to recognize the value of having a practical and operational list of vital conditions, and it's getting talked about and featured in more and more places across the organizational landscape. Of course, these vital conditions are not independent of each other. They're all a package. We couldn't do, you can't assure some and leave others unattended. They're intertwined in a very powerful way. And of course, they're all connected from belonging and civic muscle in a way, because while that's both a vital condition unto itself, it's also a pragmatic necessity that we need to make progress and achieve success in any of the other areas. And so this image positions belonging and civic muscle at the center, which is then expressed in all the other vital conditions as an interdependent package. So when those conditions are in place, that's what actually causes people to thrive. It limits the adversity and urgent need that we might experience and creates, what is the potential for intergenerational thriving spiral. But more often than not, those vital conditions are not in place for all of us. And as a result, a number of really difficult sources of adversity and urgent need can accumulate. These are like acute illness and injury and addiction, homelessness and poverty and crime and pollution, natural disasters. These are the things that actually cause us to feel like we're struggling and suffering. If we have to endure those, it can create an intergenerational suffering spiral very quickly that spreads across neighborhoods and transcends and spreads across generations. Actually, these vital conditions and adversities are really rooted in long legacies for how we live together. Right? We are unique people in a common world, and how we work across those differences and how we treat each other have powerful effects that get created and recreated over generations. Some of these legacies are really expressing dignity and inclusion. Right? They build belonging and civic muscle. They reinforce the idea that everybody has a place and can contribute, and that shows up across all the vital conditions. On the other hand, legacies that inflict trauma and exclusion do two really harmful things. They dehumanize everybody who's connected to that, driving a lot of adversity and urgent need, and they break down that sense of belonging and civic muscle by setting up an othering dynamic where the us and them positions some people as able to thrive and at the expense of many others. Both sides of these legacies can get reinforced over time, right? The more that we each move toward belonging and toward dignity and inclusion builds that belonging and helps us move closer to creating a commonwealth together. On the other hand, our legacies of trauma and exclusion can cause us to turn a blind eye toward adversity in our midst and really erode those legacies for being able to live together. So in response to this, we believe that shared stewardship can steer this system toward much greater well-being and equity. And stepping into roles as shared stewards really relies on first recognizing the value in every step toward inclusion and the work that it takes to expand vital conditions. And it also has to couple with reconciling the loss of long, very painful legacies of past and still ongoing exclusion. So that's the first step for stewards. The tasks, the work of stewards really is expressed in two ways in this diagram. The first is to expand vital conditions. These vital conditions have been neglected, in some cases underinvested or divested from, and there's a lot of trapped human potential that stewards can help to unlock by their efforts to expand one or more of these vital conditions. There's also a great deal of adversity and urgent need in our midst, and stewards can express their connection to care for people in crisis, right? To deliver the urgent services that anybody under adversity might need temporarily to get help. This would be acute care for illness or injury, or addiction treatment, or criminal justice, or environmental cleanup, or homeless services, or unemployment and food assistance. These urgent services are critical to help keep up with the sort of the sense of struggling and suffering, but you can see even from this diagram that there's no amount of delivery of urgent service that could be enough to overcome that intergenerational suffering spiral unless our stewardship also focuses on vital conditions and really traces into the root cause of reducing the trauma and exclusion that's producing this adversity, and really create a more equitable society where dignity and inclusion becomes the norm. Now, there are also some complicated economics that figure into this, and there's just a couple more steps of this story. If there are large fractions of folks who are struggling and suffering, they create markets for urgent service industries, right? And these are life-saving services that all of us need, and they need to be delivered at scale. They need to be effective and equitable and cost efficient. And so meeting the demand for these services is absolutely critical. We have developed pretty elaborate markets where there's a hospital industrial complex now, and a addiction industrial complex, and a poverty industrial complex, and a prison industrial complex. These industries have grown partly to catch up with the enormous demand, intergenerational demand that's created by having lots of folks who feel like they're struggling and suffering. Another complicated thing that can happen as these markets develop is as the belief can set in, really a mistaken belief, that services are enough, especially services that are delivered to people who are perceived as other. There can be a mistaken belief that that's all we need to do is to deliver services to alleviate these needs. And it can over-relying on these urgent service industries in ways that actually leave a lot of our enormous potential untapped, and really place a drag on our ability to be both healthy and to unlock economic potential. There is now a widespread conversation about what kind of economy do we want to create across America, and a discussion now that we can reimagine capitalism in ways where we can combine just purpose and profit and actually have an economy that's centered on producing the conditions that we all need to thrive. And more thriving people unlocks even more ingenuity and even more economic potential. And so one of the questions is whether our economy is really going to be centered on adversity and constantly trying to keep up with the demand for urgent service, or whether we can build an economy that really unlocks our potential, delivers urgent services, and enables us all to thrive. And that's where its power and vitality comes from. Now, stewards of the past have really relied on the bottom half of this diagram for a while, and we find ourselves with very high demand for services, and very costly services that we're trying to keep up with, and really a lot of trauma and exclusion that causes some people to feel like they have a place, and many others to feel like they don't. So stewards of the future, starting now and going on into the future, are going to have to do a lot more on the top if we want to expand well-being and equity for all. Now that we've gotten a sense of these dynamics, you can even simplify this diagram to see that it is our legacies for living together, and the twin sides of them, whether they express dignity and inclusion and expand vital conditions in a well-being economy. That's the path to generate and produce a lot more thriving. And at the same time, we have to recognize that we are still coping with long legacies of trauma and exclusion, and how to address adversity and urgent needs, and the size of an adversity economy that we've created over time. So our work as stewards in this is very clear, right? We should be moving toward, celebrating every step toward inclusion, expanding vital conditions, and creating a well-being economy. And that really raises interesting questions about how to begin, right? If that makes sense, you're ready to do this work, or you've been at this work for a long time. How do we get even more effective at stepping into these roles? There are a number of conditions that hold any system in place, and it is changing those conditions that actually unlocks the potential for dramatic and far-reaching system change. It starts with shifting our mindsets, our narratives, our relationships, power dynamics. Those are the things that really are the deep-seated structures and that from which any system emerges. We can really shift what we value, and what we measure, and what we hold ourselves accountable to do, and the kinds of mutual accountabilities that we build with each other. And ultimately, we're going to have to shift our policies, our practices, our investments, because those are the outward manifestations of the structures and priorities that we've all developed. This can also mean strengthening our alliances with other people and other organizations where there are shared values, where we can engage in shared processes, and when we can organize around common measures like everybody thriving. This begins to orient our work toward creating the system that we all want and need. we can focus on those pace setters across contexts that are beginning to live out these values and showing what it looks like to be able to do this work in real circumstances across the country. And we're going to be able to strengthen our capacities to learn with each other, to exchange insights, to actually do this work together, individually and together. Now, lots and lots of organizations across the landscape are beginning to step up and self-organize around one or more pieces of the narrative that you've just heard. And they are forming new relationships and new kinds of power dynamics and proposing new kinds of policies and practices and resource flows. There are change agents across the spectrum. And so the question is, where would you start? One group, the Wellbeing in the Nation Network, is a terrific example where this is a open platform for lots of people to connect around their shared interests, and their top level theory of change captures in this one image almost all of the things that we've talked about, right? A commitment to create legacies for living together that actually express inclusion and that we would be proud to pass along for future generations. A commitment to expand vital conditions, not just one or another of them, but the whole package so all of us can thrive. And to see this work as the work of stewards, people and organizations who step into roles with shared responsibility and specifically working in solidarity with those who are struggling and suffering today to create the conditions that we all need to thrive tomorrow and into the future. So the question is, what is your organization capable of doing, and what are you capable of doing as a steward to produce more well-being and equity in the world? So we'll stop the story here and look forward to talking with you around all of this work.